Just 1 sec if you could, I apologize. You good? Judy? Good. Oh, good afternoon, everyone. What we're going to do, and Duvy, when I give you the high sign, we'll start with you. We'll love everyone. You good? Okay. We'd love to just go around and everyone introduce themselves. But before we do that, just to say good afternoon, it is I want to thank first and foremost the folks seated around this table for joining, but thanks as well to everybody here in Ocean County, especially the Office of Emergency Management for hosting us. And I can't say enough good things about the level of cooperation and intense teamwork with everyone around this table. So thanks to each and every one of you. I want to begin by saying that on behalf of my wife Tammy and I, we send our best wishes to President Trump and First Lady Melania Trump for a speedy and complete return to good health. And I'm certain this is shared and echoed by everyone around this table and around this state. If there is one thing we have learned in New Jersey over these past 6 or 7 months, it is that we all pull together and support everyone fighting this virus. I have reached out to the White House, to family members today. George Helmey's reached out to the White House, to the RNC, and the president has heard that we are praying for him, and we ask you to keep the president and the first lady in your prayers. But I would also say this, and Judy will probably want to land on this as well in her remarks. We urge everyone who was in and around the Bedminster event or events yesterday to take full precautions, including self-quarantining and ultimately getting tested. I think Judy and the health experts would want me to say, if you just get tested today, you won't have given the virus enough time to incubate. You won't know. You're doing that kind of blindly. So the key is really sequencing, self-quarantine everybody, take yourself off the field, wait, Judy, 5 or 7 days probably in that range and get tested. Even then, if you test negative, you really have to stay off the field for the full 14 days and probably would want to get tested again at the end of that period. And as Judy and George Helmy to my left will probably note, the process for gathering information for case investigation and contact tracing has begun. And as far as we know, folks are cooperating and we need them to. So, before we get into the subject of why we're here today, Duvy, I wonder if I could cue you to just, if everyone could briefly go around the table. And I can't say enough how much we appreciate everyone being here today and for your leadership every day. Please.
Hi, my name is Dovie Honig, founder and CEO of the Orthodox Jewish Chamber of Commerce. We're excited to work with the governor on restarting the state and working together on maintaining COVID-19.
Thank you. Thank you, Duvie, for everything. Please.
Hi, my name is Shireen Semple. I'm the director for the Office of Local Public Health at the New Jersey Department of Health, and very thankful for everyone here today.
Thanks for being here, Shireen.
David Adnero, I'm the Deputy Commissioner of Health.
Thank you, David.
Eric Adler, I'm the Regional Epidemiologist with the Communicable Disease Service with the State Health Department.
Good to have you, Eric.
Hi, Dr. David Friedman. I'm the CEO of the Chemed Community Health Center in Lakewood, New Jersey.
Thanks, Dr. Friedman. I just had to go big before he says it. Everyone knows who Bob Singer is, but Senator, I just want to tell you, you've been a great teammate for us for every step of the way in our administration, and especially during this COVID pandemic.
Thank you. Thank you, Governor, and certainly thank your Chief of Staff and especially the Commissioner. Super job. Thank you, Commissioner. Senator Bob Singer, and I'm also Vice Chairman of the Ocean County Board of Health.
Bless you. The woman who needs no introduction is going to introduce herself.
Judy Persichilli, the Commissioner of Health.
Thank you, Judy.
George Helmy, Chief of Staff to the Governor.
Thank you, George.
Pat Callahan, New Jersey State Police.
Another guy who needs no introduction.
Rick Berquist, Under Sheriff Ocean County, here representing Sheriff Michael Mastronardi, who's unable to attend today, and he welcomes everybody. Thank you, Governor.
Yeah, and Rick, good to have you. And I had a nice exchange with the sheriff this morning. He wanted to be here. He told me he's watching, so we'll give you a shout out, Sheriff Mastronardi. He and I spoke on the phone the other day as well. Great to have you.
Thank you, Governor.
Carl Block, Ocean County Administrator, representing the Board of Freeholders.
Carl, thank
Soon
you
to
for
be
being here. What's that?
Soon to be commissioners.
Soon to be commissioners. Thank you for today and for everything. Hey, Mayor.
Morning, Mayor Lichtenstein, Lakewood Township Committee, representing our Mayor and Township Committee in Lakewood.
Thank you, Mayor.
Good afternoon, Avi Schnall, New Jersey Director for the Agudath Israel of America.
Rabbi, thank you, man.
Thank you.
Good afternoon, Dan Regney, Health Officer, Ocean County Health Department.
Thank you, Dan.
Laura Winters, Superintendent of Lakewood School District.
Laura, last but not least, as they say, thank you for everything you're doing. So thanks, everybody. So today is going to be a little bit of a different kind of briefing. We're outdoors, among other things. I will not, for example, be memorializing those we have lost, as is our usual practice, but please keep them and their families and loved ones in your prayers. We'll be back in Trenton on Monday with our usual format. Today, the circumstances warrant that we be here. Over the past couple of weeks, as we've said, and everyone here knows this, Ocean County has led the state in the numbers of new cases. All of us here have been working together to tackle this. This county's share of cases, as measured per 100,000 residents, has far exceeded the statewide average, as has its positivity rate. And in looking at Lakewood, but not just Lakewood, as Judy pointed out and points out, there are a number of communities that are hotspots right now, not just in this county, but certainly in this county. But looking at Lakewood and its surroundings, the numbers are certainly deeply concerning. So let me be perfectly clear. We are not here, no one is here to point fingers or to cast blame. If there's one thing we've learned, and I mentioned this with the President and First Lady, over the past 7 months, it's that we can only tackle this emergency when we all pull together. And this is reflective. This group of folks who are gathered here today is reflective of this. I would also say this, however, what we're seeing in Ocean County, and I'll go through the state numbers in a minute, is a reason why we cannot become complacent. This virus is a virus of opportunity, and when we let our guard down, we give it the opportunity to rush in. So today is about working together to close the window of opportunity to drive down the numbers here and in the immediate surrounding areas, and to keep moving forward as one state. And I can't say enough about, again, the teamwork and the spirit of coming together. Everybody's left their political ideologies at the door and have come in and found common ground consistently. And on behalf of all of you and of all of us, I say thank you. Let me give you the latest statewide numbers if I can, and they are significant. We're reporting today another 796 positive tests. That brings our statewide total to 206,629. The positivity rate for all these tests recorded on September 28, which by the way was Monday, was 2.47%, and the rate of transmission has crept up to 1.19. And looking at Ocean County specifically today, there are 190 of those 796 cases, 190 new cases with a countywide positivity rate of just under 16%. As of last night, our hospitals were treating a total of 528 COVID-19 confirmed or suspected patients. Judy, that's the first time we're over 500 in quite some time, of whom 98 were in our intensive care units and 36 were requiring a ventilator. And sadly, we must report another, with a heavy heart, 4 confirmed COVID-19 related deaths, and the total now stands at 14,344 confirmed fatalities, with another 1,787 probable deaths. And our thoughts remain with every family who has been impacted. I know I don't have to say this to the group gathered here today, because the level of responsibility in this group is outstanding. But enough already. There are still folks out there that are saying reckless, irresponsible things. We have now let there be no doubt what the facts are telling us, that we have a significant amount of cases, and it's not just in Ocean County. It's up and down the state. I've been back and forth with the leadership of a number of the big hospitals this morning. The good news is they're far more prepared for this. The better news is they're able to treat folks in a way that they've learned, as Judy and David and their colleagues will say, that we've learned an enormous amount over the past 7 months. But folks, we're still in the thick of the fight. And the basic stuff is all that we have. In the absence of a therapeutic, in the absence of a vaccine, it's social distancing, it's face masks, it's washing hands with soap and water, it's taking yourself off the field if you've been exposed or you've got symptoms. It's getting tested at that right moment in time. Folks, we cannot let up. Enough of this reckless, irresponsible words and behavior. It is time to pin ourselves back down against the science, the data, and the facts. So, switch gears for 1 second. I encourage everyone to download the new COVID Alert NJ Exposure Notification app, which is available for download both through the Apple App Store and the Google Play Store. The more phones that have the app, the better we can fight this pandemic. My wife downloaded it in front of me this morning, and it is really impressive. And we're doing this, as you folks probably know from our announcement, we're doing it with New York, Pennsylvania, and Delaware. We're all on the same platform. That makes it even more powerful. Just to say, yesterday, because we weren't with you, with our friends in the press, the Department of Labor announced that more than 27,000 New Jerseyans filed an initial claim for unemployment over the past week. That's a 10% increase, mostly driven by an increase in the number of residents seeking pandemic unemployment assistance. And remember, these are workers not eligible for regular unemployment insurance assistance. 96, I'm happy to say, 96% of all who have been deemed monetarily eligible have received payment, with the average now having received 15 weeks of benefit. And I thank Commissioner Robasera Angelo and his entire team at the department for their continued hard work. I want to give, just because there's some amount of uncertainty as to where the end zone is on the census, so allow me just to throw this one out and give another plug to respond to the census if you haven't already. Our statewide self-response rate exceeds 69%. Ocean County is just a hair behind that. But when the results are added from the door-to-door count to that number, we're at more than 99% counted statewide. But nobody should be left uncounted. Our future rides on a complete and accurate census, so go to 2020census.gov to be counted. So that's it from my seat. And I want to say to all observing the Jewish high holy days, bless you, Chag Sameach, to each and every one of you. I will now turn things over. We got a few speakers here, and then we're going to throw it open for a discussion and a few questions from our members of the press. Let me turn it over to the woman on my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli, and right after her, we'll go to her right to Senator Bob Singer. Judy?
Thank you, Governor, and good afternoon. And thank you to Ocean County and Lakewood leaders for joining us today and for all your support throughout the COVID-19 pandemic, especially as we work together to address a rise in the cases. Senator Singer, thank you for your leadership on all health issues as Vice Chair of the local Board of Health here in Ocean County and also as a member of the Health Committee. I also want to acknowledge Ocean County's Health Officer, Dan Regney. He is strong, well experienced, and a trusted partner for the Department of Health. He has been alongside us with many responses and is a great advocate for all of the residents of Ocean County. Along with the County Health Department, we have been monitoring the uptick in cases locally. In the past week, between the 24th and the 30th, there has been a total of 1,214 COVID-19 cases reported in Ocean County. 840 of those cases were in Lakewood. There is not a single event that is associated with the increase in cases. But as you know, there have been large religious observances over the past several weeks that may have resulted in prolonged close contact. And there have been reports of some large gatherings, weddings, funerals, where social distancing and wearing masks may not have been consistently followed. About a third of the cases in both Ocean County as a whole and in Lakewood specifically are in the 30 to 49-year-old category and the 18 to 29-year age group. Today, of the 796 new cases we are reporting, there are 190 new cases from Ocean County, and 126 of those cases are in Lakewood. To help respond to the increase in cases locally, the department has sent over 6,000 test kits to be used. We are also increasing testing sites. Vault is testing today at a pop-up site in a municipal lot and will be there on Monday and Tuesday as well. From 9 to 4 next week, they will be at the Blue Claws Stadium and hopefully at the public high school next week from Wednesday to Saturday. We have deployed 2 nurses to assist Chemed in their testing as of yesterday. And the plan is to have them on site for 2 weeks. And if you need them longer, you just give us a call. In addition to getting tested, if you were exposed, we also need everyone to participate in contact tracing. We have redeployed 20 contact tracers to Ocean County to help with these investigations. It is vital to share your contacts. If you have tested positive for the virus, please take the call. Right now, those willing to give contacts is under 50%. We know that will increase. Many households in Lakewood are large and multi-generational, which make home isolation and quarantine very difficult. For large households or homes with many individuals, persons who are sick should remain in a separate room, a separate bedroom, and stay away from anyone who is not exhibiting illness. Do that as much as possible. If the sick person cannot be isolated in a separate room, consider having them isolate in an alternate location that has a separate bedroom and bathroom for them to rest and recover. If a family member has an underlying condition, please keep them safe. Consider having them quarantine at a nearby alternate site away from the sick individual. If the sick person needs to leave the bedroom to use the bathroom or the kitchen, make sure they wear a mask. The sick individual should not eat meals with others in the household to limit the spread of the virus within the home. All persons living in the home should practice good hand hygiene. Wash your hands frequently with soap and water, and please use hand sanitizer that contains at least 60% alcohol. Cleaning frequently touched surfaces regularly is important, especially in the bathroom, as well as doorknobs and stair rails. The governor shared the overall positivity as of September 28th as 2.47%. In the northern part of the state, we're reporting 2.09%, the central part of the state 2.89%, and the southern part of the state 2.65%. Today's positivity for Ocean County is 15.85%. For Lakewood, it is 27.82%. We are also seeing increases in Lacey, Stafford, and Jackson. Some of this may be due to low testing levels, so please urge everyone to get tested. Moving on, as the governor said, the Department of Health is working with the Somerset County Health Department on a case investigation for a fundraising event in Bedminster. We have been in contact with them since early this morning, and we continue to gather more information on the event and the attendees. If you attended the event, please feel free to contact your local health department if you have any questions so they can advise you on public health precautions. Most importantly, if you feel ill, get tested. Call your primary care physician. Get tested. Depending on your exposure, that is, if you were within 6 feet of someone who is positive for more than 10 minutes, you may have to quarantine for 14 days. if you did not practice the adequate social distancing and masking. Please also download the COVID Alert NJ app, New Jersey's free exposure notification app. The mobile app is available to anyone 18 years old or older who lives, works, or goes to school here in New Jersey. Visit the Google Play Store or the Apple App Store on your mobile device and search for COVID Alert NJ and click download. There have been more than 55,000 downloads of the app since we launched it yesterday. And lastly, as always, stay safe for each other, for us all. Please take the call and download the app. Thank you.
Judy, thank you. Well said, as always. I mentioned that following Judy, we're honored to have Senator Bob Singer with us today. Obviously, someone who wears several hats, including a big health-related hat. Senator, it's an honor to have you with us. Please take it away.
Thank you, Governor. It's an honor that you're here today with us. First, I want to just thank the Commissioner again. Last Friday, she had us on a call with Committeeman Lichtenstein, Rabbi Schnell, Dr. Friedman, Dan Regney, and all of us to discuss how the state was helping us right here in Ocean County. She shipped in over 6,000 test kits for us that were needed. We increased the testing factor. She brought in as she said, the tracers, which were important for us, and certainly additional nurses. As you know, the County Board of Health is running a major testing facility at the community college. We are keeping that going. I will tell you that my legislative office is in the same building as Chemed, and the parking lot every morning is jam-packed with people testing. And that goes a lot to the community itself. The medical community in Lakewood have written a number of letters in the papers, have reached out to the community to echo what you've been saying, giving their support and letting them know that what you say is important. They have to do the social distancing. They should be using masks. The rabbis have come out, and they have made it very clear that certainly in public spaces you should be wearing masks and it's social distancing. And each individual rabbi certainly is talking to his congregation individually, which is the best way to get the word out. Amen. So I must give true accolades to Avi Schnell, Dr. Friedman, and Committeeman Lichtenstein, who have made a major effort to make sure the community is engaged and understand this. And the important fact is that everyone has the word out about getting testing. And you can see that in every test site. They're lined up early in the morning. They understand the importance of the testing. We are doing that now, and your support and help in that is important, as well as the contact tracing. So thank you, Commissioner, and know that Lakewood is committed in that direction and will continue to work with you for the health and welfare of the community as a whole, and certainly the county and the state. Governor, thank you. You have been our leader in this. You have made it very, very clear that the health and welfare of the state is the first priority, and that is the most important thing. You've committed your entire team to that. We look for you for direction. We want to work with you. We appreciate the fact, the sensitivity. There's no question about it. The high holidays, there is a tremendous connection with Muncie, which is in Rockland County. There's tremendous connections with Brooklyn. There is a certain amount of transportation back and forth. Certainly, all of that leads to certain aspects of things, but the community appreciates you and appreciates the fact that you support them in that, and understanding that religion is important to us and health is just as important. So thank you, Governor, so much for what you do and what you continue to do for the state of New Jersey.
Bob, thank you, and likewise, right back to you. And I think what you just said, not only the good words toward Judy and the health team, but the last comment you made, this is the right to worship and worship responsibly is something that all of us hold dear. We just have to be very responsible about that. So thank you, Bob, for everything you do. Would love to get a couple of quick thoughts from the Ocean County leadership. We got the undersheriff here, we got Carl, we got Dan, and then when we do that, I think we're going to turn to you, Avi, to lead off just a brief table discussion, community discussion. Anything, sir, you want to throw in, Under Sheriff?
Governor, I'd like to express my gratitude for your leadership, to Senator Singer's leadership, certainly the Colonel's leadership through our Office of Emergency Management. And I do want to give a shout out to the members of the Office of Emergency Management here. Captain Dave Shank and his crew have done a yeoman's job getting out PPE, setting up testing sites, decontamination sites, and we look forward to continue to working with you as well as all of our partners and friends from Lakewood. Thank you.
Is Dave here, by the way?
He is, sir.
Dave, where are you? Because you're a name that I know well. Wherever he is.
Captain
he's
Shank.
in the back there. Thank you, Dave. Carl, how you feeling, and any words of wisdom you've got from the perspective of the county administration?
On behalf of the freeholders, obviously, we are tasked with being full cooperative partners with whether it be Lakewood or the other, or all 33 towns in the county. Also is distributing CARES funds to try to help mitigate cost factors for towns and try to run the county at the same time, and a general election at the same time. They all come with their challenges, and with some complicating others. But the freeholders have been committed to trying to deal with all those issues at the same time. We are every day looking for ways to, whether it is to help the health department, whatever the state is able to do, if they need something extra upon that. I know that we have offered to the towns through the CARES money to fund any local testing that they may undertake. We test our employees. We have tested all of them and are going back for a second round. Some friends of yours at VNA. Every project, whether it be reopening buildings to the public, making sure they are safe, thermal cameras, mask. You can't get in the building without a mask, but still keeping the county business running. So we have a lot of responsibilities, and the freeholders are united in that and are correct. That is not conquering COVID is not a partisan issue.
No, it is not. Carl, thank you. Please give Joe and the rest of the team our very best wishes and thanks for their great cooperation. Dan, from the health perspective here, great work by you and your team. Any words of wisdom?
Well, thank you, Governor and Commissioner, and also Shireen for coming out here today and opening up and opportunities to have some conversation. I would just say is that whenever you're faced with adversity and looking at a challenge in front of you, which I would certainly put this into that category, you look around you in terms of what resource, what allocations, and what you have around you to address that issue at hand. In Ocean County, I think this is the same, and speaking for many of my colleagues throughout the state and health officers, that we have a tremendous amount of support. We have a tremendous group of partners here within Ocean County, starting very early on, working with the schools on closures and working with the law enforcement community and working closely with the prosecutor who's here today and the sheriff and all the local police chiefs that have been working with us throughout all this. The schools have been an incredible partner. We did a school reopening task force that we started back at the end of May, and we were on almost weekly calls between the superintendents, the principals, and all the school nurses to be able to share some information, concerns, and hear how we can help them in through some of that challenging time in any way that we possibly can. The healthcare community, the two FQHCs, both Chemed and OHI, they've been tremendous partners in testing and in working with us. The physician community throughout the community getting messaging out to all of our partners and constituents throughout the state has been phenomenal. You really can't ask for more. And the staff at Ocean County Health and I would say probably throughout the state, the public health workforce in the state of New Jersey and the group that we have here in Ocean County. I have two of them with me today. My Deputy Health Officer, Patty High, and our Chief Epidemiologist, Jennifer Crawford, who have spent a tremendous amount of time and efforts with this. And we have a whole team that's really going nonstop around the clock. And it's great to see all that concerted and dedicated effort working in unison to move forward.
This great phrase, "It takes a village," has never been more accurate, given how many different hands and feet we need up against this. So thank you, Dan, for your work. I attribute this to both poor eyesight on my part and mask wearing, but I didn't see Prosecutor Brad Billheimer's here. Brad, good to see you, and thanks for your leadership as always. So, Rabbi, we were going to have a brief sort of discussion, and I'm told you're going to lead us off. Avi is a dear friend. We see each other in both peacetime and in more challenging times, and this is a challenging one. Thank you for your leadership.
And the common goal of all of those times, Governor, is that we're always together, and with a tremendous amount of respect. The senator, really said it. I can't expand more upon that. How grateful we are for this relationship. How grateful we are that we're sitting today in New Jersey with Governor Murphy at the lead. And we don't take it for granted at all. And I think I'd be remiss if I didn't give a shout out to your incredible administration. George Helmy, he's always there for us. From the day that the spike started, we got a text from another incredible friend, Deborah Kornavakis, who I don't think 5 hours has gone by in the past 3 weeks that myself and Committeeman Lichtenstein has not been in touch with her.
Amen.
And it's an incredible relationship, and that we have the access to be able to discuss this. So we got to get on the call. George wants to talk to you guys. We got to deal with this. And of course, when George says get on the call, we get on the call.
I do what I'm told as well.
So we got on the call, and the commissioner was there, and we heard the issue, and we sprung into action, and we are doing whatever we can. We had a call yesterday with the commissioner. Thank you again, Commissioner. We knew it was a hard time yesterday, but you found the time to meet with us with a group of the rabbinic leadership of Lakewood.
Yep.
And following that call, we had to cut at a hard deadline at 3:30, because following that call, we had another conference call with the rabbinic leadership, had a call with over 100 synagogue rabbis, giving over the message. We need to test, we need to be vigilant, we need to wear masks, we need to practice the social distancings. In my synagogue, we have 4 tents on all 4 sides of the synagogue, so that people can have more space. Wherever you go in Lakewood, you see tents popping up all over the place.
Yep.
It's not just a sukkah for the holiday that we celebrate now, it's tents outside of the synagogues. Many synagogues have signs in front. So we're going to get there, we're going to tackle this, we're going to conquer this, but we're only going to do this together as we've been doing it, and we're so grateful, and we don't take this for granted.
You're the best. Bless you.
And I'll just say, the resources that we're getting is incredible, and just keep it coming.
All right, we'll
keep
do
it
that.
coming.
Mayor, anything you want to add to Avi's
Sure.
good
Thank
words?
you.
Thank you, Avi.
Thank you, Governor, and I too would like to echo what Avi said about the incredible help we're getting from Trenton. Governor, if I may, in more of a discussion form, I think the community is ready to take a lot of the tests since the phone call with the commissioner yesterday and 2 days ago, and the rabbis put that out. We could use those tests, as Avi says, to keep coming. I think that if we could get connected even better with Vault, and I think we're dealing with somebody in your staff, we have rabbis who have designated people in their synagogue willing to call 200 people in and take the test.
Yep.
We need to move a little faster on getting them the test, and whatever support we can get from you, that would be tremendously appreciated.
So, Mayor, we sign us up for that. We had a good. How about the weather, by the way? We could use more days like today.
Yes,
the only problem is the
no
wind
question.
is wreaking havoc here. We had a really good breakthrough earlier in the week. The White House has designated $2.6 million over the next 12 weeks, beginning, I think, end of next week or early the week after, Judy, right, of so-called Binax tests, which give you a result in 15 minutes.
Great.
And when we were asked where would we envision those in use, high on that list were hotspots. By the way, also, Madam Superintendent, high on that list were schools.
Yes.
To not just have to get stuff open, which we desperately want to do as long as we could do it responsibly, but to keep things open, which we also want to do. That's a good suggestion, Mayor.
Thank you, Governor. And what we're willing to do and roll up our sleeves is be your force multiplier. So
Great.
if you have one leader or one person that you designate to us, like what we just did with the site that popped up today at 10th and Clifton, we'll get you volunteers, we'll get you the police officer, we'll get you public. I mean, we had that site up and running literally in a couple of hours, and
Great.
before it opened up, I think there were probably 30 or 40 people online already.
Fantastic.
So
Okay.
thank you, Governor.
Word of those. Madam Superintendent, Laura, a quick sense of how are things going inside of the schools?
Things are going very well. I wanted to thank the staff, the students, the families of Lakewood Public Schools. As of yesterday, we have approximately, since September 1st, we have 7 students and approximately 10 teachers that have been COVID positive. And I would like to thank Ocean County Health Department. We've been working fabulously with Dan and his team. They've been great with Jennifer. And we have plans to have a site for testing at Lakewood High School, which will start next week. So I would like to thank you for that, and things have been going very well.
And again, Laura, the notion that you could have, which is I think what we kind of envision. This is not an unending supply, by the way, so we don't have it forever and always. But the notion of the school nurse having the ability to perform a test where you get a result within 15 minutes, which is, Judy reminds us, highly, highly accurate, right?
That would be great.
Is hugely appealing. So
Yes,
keep
that
up
would
the
be
great
great.
work.
Okay.
Duvy, how is it in the business community? How are you doing? Great to have you here. How's life through the lens of the our small businesses that keep the state going?
Thank you, Governor. Thank you for your leadership, and thank you, Commissioner, and of course I want to thank Deb for being in touch with us. As Avi said, within 5 hours, every 5 hours we're in touch throughout since the epidemic, and we launched this initiative, Help Stop the Spread.
Yep.
For the Orthodox Jewish Chamber of Commerce, and I want to say that before the holidays, we had 70 synagogues sign up fit, and we gave out free masks to 70 synagogues, and so that shows the response from the community is that they're alert and they're in touch. We also give out to all the businesses, to schools, to school buses, and encourage awareness constantly, and we find it, everyone being very receptive. So I feel the more we could create awareness to help stop the spread, and as the mayor said, the more tools we have and the more support we have, we can amplify and multiply it. And just today, thank God we're able to set up. I was able to facilitate the Blue Claw Stadium for Monday's testings, and we just got confirmation, just working on those logistics. But the team and Governor, what you have set up is the communications unreal. The openness and the reaching out to us, how's everything? As you yourself reach out directly, text Duvy, how's it going? That's not seen anywhere, and we network and are well beyond New Jersey. So I want to thank you for that leadership, and look forward to continue working with the team.
Duvy, thank you, and you've been there at every step of the way for us as well. So thank you. Maybe one more, Dr. Friedman, your perspective from Chemed, and then we'll throw it open, if it's okay, to a few questions from the press, if that's all right with everybody. Nice to see you, Doc. It was good exchanging notes the other day as well.
Thank you. Commissioner, first of all, Governor, I should say first, thank you for everything that you've done for us. I really appreciate it.
My pleasure.
Commissioner, thanks for your help, and thanks for realizing that the work that we do at the FQHCs and sending the support that we need to allow us to do the mission that we do. As everybody knows, we service the uninsured and the underinsured, and we are a large federal community health center servicing about 50,000 people a year. We're very fortunate to be in Ocean County. I have to say that all the partners at the table are fantastic partners for us. We've worked very hard to actually help the school district, both private and the public schools, to help them in opening and to have a safe environment for the schools. We've really tried to ramp up our testing, and just to give you some figures, we've actually tested from the beginning of COVID over 26,000 individuals with PCR testing.
Yep.
And more recently, we actually, in the new uptick, we've tested over about 3,500 people.
Wow.
So we are testing approximately 750 to 800 people a day now. And we actually purchased at our own expense rapid tests so that we could actually encourage people to come in under appropriate circumstances and get rapid testing done. And
Right.
we continue our efforts to work together, but we couldn't do it without the partners that we have around the table, without the governor, and without the commissioner. So we thank you very much.
Thank you, Doc. You guys do incredible work for those who need it the most, I might add. Thank you. With that, we'll take a couple of, we won't do our normal go across. Brian, we'll do a couple of quickies here.
Governor, really one question, and that is, if Ocean County were a state, it would be under quarantine. Is there any, or would be, people would be told to quarantine if they love this county? Has there been any consideration of taking a drastic step like that?
No. For several reasons. One is we are all one New Jersey family, and that runs counter to the notion that we're all in this together. Secondly, the practicality of it is beyond real feasibility. And thirdly, there are other steps that we can take, and in fact we are taking, that we believe will address this, not only address it effectively, but get it under control. So you're hearing Mayor raise this, Judy's already raised it, Bob mentioned it, a lot more testing, a lot more contact tracing, a huge amount of Duvy's point, a huge amount of bully pulpit public awareness. We believe, and I think I speak on behalf of all of us, that the combination of all that gets you to the place that we need to get to. But everybody's got to take it very seriously, down to every individual, and that's the case not just in this county but everywhere. I can't say enough good things about the leadership, the absolute leadership by everybody at this table and beyond. The key for all of us, including yours truly, is to make sure that the transmission function from leadership to everybody in the community is as robust as possible. Thank you. Sir, we'll go 1, 2.
Just a quick one. You talked about not pointing fingers. There are some sensitivities. You talked about the partnerships here. How do you toe that line and make sure that you can get the message out and get people to do the right things while also balancing those sensitivities that some might have?
Yeah, I mean, please.
And then just the second question. You talked about in the past the concerns with contact tracing and the lack of cooperation. The Bedminster fundraiser in particular, a political event at a private club. Can you just walk me through the challenges that in particular presents?
So I'll be brief, but on each. We've been crystal clear from moment one of this pandemic that we're all in this together, and that there's no room for even a speck of blaming that community or this community for what's going on. And so I believe with all my heart that we can achieve that balance, that we can both be factual about where the hot spots are and what we need to do to drive them to the ground, but also defend with 1,000% vigor every single community and their right, as long as it's responsible, to do things like worship and pursue their faith. And we have no tolerance for any amount, not a speck, that would creep into this finger-pointing stuff. On the event in Bedminster, as I said, and George in particular, George and I have both been in touch with the White House. George has been in touch with the Republican National Committee. They have put forward a spirit of complete cooperation. We're still in the process of gathering the data. Judy has, whether it's Somerset County or Bedminster local health authorities, putting contact tracing focus on that. So the process is working as you would hope it would work. I'd say one, Madam Superintendent, as compared to a school, for instance, I don't know this, but my guess is there was regional attendance at the event or events that took place yesterday. That would be my guess. In other words, this is not everybody who lives in Bedminster. So we've also got to acknowledge that there'll be other communities, potentially other counties, and perhaps even folks that came in from other states. And again, the watchword is, if you were exposed and you were there, take yourself off the field. And I'll repeat what I said up front. I'm operating without a medical license. It's not really that the test that you get today is not really worth much. You got to wait a few days to allow this to incubate. Thank you for that, sir.
Yes, two questions following up on Frank's question. The first being, so are you ruling out localized mitigation strategies within Ocean County?
No. For instance, it sounds like things are going very, very well in the school district, but we have been dealing with our schools on a district by district basis. And so if I'm using that as an example. Could there potentially be some shift in a local strategy? Absolutely. The question I was asked about was quarantining. I can't rule anything in or out right now. It's too early to tell, other than we're taking this, as you would hope, very seriously. Dustin.
Read the FBI report yet? Or the FDA? If not, why not? If so, can I just get your reaction? In general, they're also going to keep running that your office with regular contact on
Yeah, I have not read it. We've had a few balls in the air. We are right now trying to save as many lives as we can, and I would just repeat, Manny Silva's doing a great job leading the SDA. Brent.
Have yeshivas been following reopening plans, and if not, should they be? And then I had questions about Lakewood schools. Do Lakewood Public Schools have the highest number in the state? It's also one of the few districts to go to 5 days a week. Any plans to go hybrid or all remote? How is the state enduring more than 100 private schools in Lakewood for social distancing and have been in those schools?
I didn't recognize you with the sunglasses. I apologize. I think everyone's trying to do the right thing. Avi or Mayor, you want to talk about the yeshiva question, and then Laura can talk about the schools.
I could definitely say that practically all of the yeshivas have filled out the certification requirement. They have filled out the attestation forms. They all have reopening plans. And my kid goes to school every morning. He can't get on the bus unless he has his mask. So from whatever we know on the general level, they all have opening plans. The certification rate, so to speak, there are a lot of schools there, is almost at 100%. So they're definitely following all of the required mandates. They're definitely following those.
And Bob, you would want me to say, I know he's a humble guy, but I also would want to make the point that Rabbi Aaron Kotler, who could not be with us today, has been with us every step of the way as it relates to the BMG and the broader community.
Absolutely.
Laura, any comments on?
At
It
this
feels
time,
like so far so good, right?
So far so good, and we plan on doing 5-day in person. But however, if the numbers change, we're always following the numbers, and it's a numbers game at this time. And if the numbers change and we see something different, we have to look at that.
You reserve the right.
Right.
Brett, your last question after school was?
It was that was pretty much it. It was how is the state ensuring that 100 private schools are social distancing?
Oh, we're doing what we're doing with every school, and everyone is taking it serious. Duvi, you want to come in?
Yeah, I would like to just address along these lines how Lakewood is being singled out, and the governor with the history of New Jersey with anti-Semitism, with the challenges we had early this year, unfortunately, with the Jersey city attack, and also in Lakewood, New Jersey, when we sent down the Homeland Security that we hosted to speak about it and be able to combat anti-Semitism, and SWAT stickers being put up on Jewish businesses. We're concerned, and I feel also hesitation in the test places where we want to increase the testing, how it's given over to the media and reflects on Lakewood. Because Commissioner, when we have increased testing, so our numbers are higher, but we're doing increased testing to stay safe, not to show the media or be misrepresented that our numbers are much higher, what causes hate and could increase the challenge of anti-Semitism, what we worked so hard, Governor, together to be able to bring down. So my request is twofold. One, Commissioner, is there a way to recreate the numbers, not just by tests, because it should be some type of give and take. When if you have an increase of testing in one location, the numbers should reflect in a way based on a certain percentage, but not based on the testing, because that's false information. Because if we would increase the testing all over New Jersey or other parts of Ocean County, I'm sure we'll have much higher numbers there as well. So with anti-Semitism.
What was your second? Do you have a second suggestion, or were they both wrapped in there?
They're pretty much one's connected with the other.
So, Doobie, we take this very seriously. And by the way,
my second question, I remember, I'm
okay,
trying to interrupt you, is that if the governor could, we have all the media here, we know how media could influence, and if you could kindly ask the media now, and I would like them to hear me addressing them, please cover us Lakewood fairly, because we want to do the testing and we want people to come out. And I feel hesitation from our leadership coming to us saying, Dovi, we want to do the testing. The test sites are great, but we're afraid it's a trick to be flagged as bigger numbers and then have repercussions.
Okay.
So,
we got it. I mean, I hope you've seen Judy and Pat and I have been there every day. Others have come in and out of our public events. We have stressed that point with great vigor, and we will continue to. You have my word. You also heard, I think, Judy say that there are other, and this is not only, we're not here only to talk about Lakewood. There are a number of communities here that she referenced up front, and they're not all in Ocean County. But we cannot allow. We're with you 1,000%. We cannot allow anyone who has ill intentions to use this as a cover to whether it's anti-Semitism, whether it's dividing us. We will accept none of that. Just before we break, I use schools as an as an example. I forget who asked me about the quarantine. I think it was Brian. We have a number. I didn't want to, because the schools are going well, so I don't want Laura to think that we don't agree with her, because you and your colleagues have done an extraordinary job. All local options are on the table, right? So that continues to be the case. So that's whether it's gatherings, whether it's businesses, schools, whatever it might be, those all have to be on the table. But God willing, with the intensity of the leadership, the testing, the contact tracing, the vigilance by everybody, we're going to get through this. We had some rough moments early on, folks, as I need not remind you, and we got through them then, right, Carl? We'll do it again, please.
If I could just follow, that occurs to me, and the increased testing is we are 100% with that, and whatever the county Board of Freeholders can do to help facilitate that, we will do that as well. It occurs to me, though, in conversation with Dan Regnay, that you have been great in sending in some additional troops, if you will, with the contact tracing. It seems to me proportionally, if the testing is going to increase, seems to me so should the contact tracing.
100%.
We would appreciate any
Great
additional
point.
help there.
And by the way, they go hand in hand, right?
Right, yes.
Because I hope someday, Carl, we'll have testing and 0% come back positive. But
That's what I'm looking for.
as long as they're coming back positive and we're increasing our testing, we need more boots on the ground. And I know Judy knows that and shares that. I want to say on behalf of all of us, this is a real treat. Thank you, by the way. Bob, is it you or Carl or the sheriff? Maybe it's Dan. Who's responsible for the weather today in Ocean County? But it got a lot better when I arrived. So thank you for that. On behalf of our team, and we've got a bunch of teammates here, but Judy, Pat, George, and myself, to each and every one of you at the county level, at the community level, whether you're in health, education, county administration, a faith leader, whatever, a health expert, we cannot thank you enough for the cooperation. Folks, we have got to stay at this. We have got to be as focused and as vigilant as we've been, frankly, since I think late spring. The numbers are significant. They're significant in this county, but it's not just in this county. And it's the basic stuff. It's social distancing, wearing this, washing hands with soap and water, staying off the field if you're not well, get tested at the right point, and listen to leaders, whether it's a faith leader, an elected, an administrator, a health expert, whoever it may be. We're all in this together. We brook and will not accept to be one speck of us versus them, of behavior that is unacceptable. New Jersey values are as strong as any values anywhere in the United States of America, and that includes the notion that as diverse as we are, we rise and fall as one family. God bless you all, and thank you.